Dan, I'm excited to kick off our podcast together and to work with you as we make sure the patient's voice is amplified in healthcare. So this is exciting.
Yeah, we've really been looking forward to it.
We have such a unique opportunity to listen to the market, and as we try to share back with everyone, what are we hearing, and especially as it's related to the patient's perspective. So why don't you tell our audience a little bit about CLAS, and then we could describe our roles and what we do.
Yeah, so CLAS has been around for 25 years in the industry now, and our core focus has always been helping provider organizations understand and sift through the claims of vendors out there. What does the customer experience look like? How well are vendors delivering for their customers? And recently we've started to look at other audiences that we can potentially help. Providers that are delivering care. We want to help them. We want to help patients and really amplify their voice. And that's what led us to do this podcast and really focus on some of our patient engagement research.
Awesome. And Dan, what's your specific role here at CLAS?
So I oversee our market research and analysis for patient engagement and telehealth research here at CLAS. And it's really a fun role. I've been doing it for the past few years, and it's fun to be a little selfish in the work I get to do and really focus on myself as a patient and do research that serves me and serves my family and serves all of my classmates and each of you that's listening to the podcast.
Makes it meaningful for us to get up and come to work and think of how can we make a difference today, right?
Right.
I agree with you. It's a really enjoyable and meaningful area for us to focus on. So in my role as research director over patient engagement, I get to help conduct the research similar to you, but also work with the vendors. And you and I partner on all of our reports and summits and things. And boy, it just keeps growing. This is an active space in healthcare, and like we've said, just an enjoyable part of what we get to do. So
yeah, it's been really fun to see, of all the tough times during the pandemic, this really has brought to the forefront the need to take care of patients, put them at the front and center of what we do in healthcare, and really treat them like the drivers of their own care that they should be.
Absolutely. The term patient-centric isn't new, but I think the pandemic threw that to the forefront, didn't it?
Yeah.
So let's talk about this podcast. We've got some guests coming that we're excited about. We are going to interview Rasu Shrestha at Atrium Health, a longtime friend of CLAS. He has a wonderful perspective to share. We've asked Michael O'Neill, founder of Get Well Network, who is both a leader in healthcare IT, but also was a patient, and the idea came to help focus on the patient's needs. I've got a neighbor and friend named Aaron Bentley we're going to bring in. He's the CIO of Salt Lake City, and being outside of healthcare, he has a unique perspective, and his family's had several care journeys he's going to talk about and just bring some insight. What does healthcare need? So I'm excited about that conversation. And also our provider friend Jerry Mansfield.
Jerry.
You know Jerry well. CNO at Mount Carmel Health System. He's helped us on some of our patient engagement summits and just has a deep passion for this. So Dan, we've got a lot of opportunities to share insights of where we think healthcare needs to go next, don't we?
Yeah, this will be an exciting group to hear from and future guests as well. It'll be fun to see who we are able to talk to and get their patient-centered perspective. As we do this podcast, it's also going to be fun to share some of the things that we're learning. We'll take a minute each episode to share things that are overheard here at CLAS as we do research interviews with provider organizations and payer organizations, and we'll also take some time to share where our research is taking us and what we're learning in some of our research efforts.
Yeah, absolutely. There's a lot we're working on, and I'm glad we have a way to share that.
So Adam, why don't we take just a minute and share a brief nugget that we've seen in our research over the past few years. We did a little bit of a series of studies over the course of a couple of years. One that looked deep into what providers are investing in,
right.
And one that looked at what vendors are delivering, what capabilities they're offering, and then we went out and surveyed the patients and asked them what are the technologies that are most important to them. And it was interesting as we compared the responses from those three groups that there were some areas where the industry is really aligned. Vendors are developing capabilities, patients want it, and providers are offering it. And there were other areas where there was a big disconnect. What was one of those areas that you saw that really stood out of this dissonance in the industry?
One of the top priorities for patients was arranging care, which means to us things like self-scheduling and just that automation, that feeling of consumerism in healthcare. We've seen a little bit of growth in that area because of the pandemic, right? Out of necessity, some of those tools had to grow. But vendors and providers, that was a little less of a priority, but it was a top priority for patients.
Yeah.
And so that was a really fun study because we got to compare those different perspectives. And I think that's another reason we're doing this podcast and focusing on the patient. Their needs are different.
Yeah, it's interesting as we think about the opening of schedules so that patients can self-schedule. Sometimes that's a barrier for provider organizations. The physicians don't want their schedules to be opened up and give the patient control. As we did this research, one of the fascinating things that stood out to me was there was an organization that shared by accident, they thought they were enabling self-scheduling for an individual provider, and they enabled it for the whole organization on accident. And they didn't find out until multiple months later, as they were reviewing some of their policies, that they had done this, and it wasn't as disruptive as they had initially expected it to be. So
you mean the sky didn't fall?
It didn't fall.
They were okay?
Yeah, so
that's amazing.
It's a fun little anecdote that we've heard, but certainly speaks to how effective that was for the patients and not disruptive for the provider organization.
Yeah, I remember that study, and that was a very interesting finding for sure. You know, I was on a call a few months ago and talked to a CIO of a health system that has been deep into implementations. They know the ins and outs of their own technology. And this provider told me they love working in healthcare, but they hate being a patient. They feel so stupid. And he told me how his wife brought home a bill and asked his help to explain it, and he couldn't explain it. It was from his own organization. And that just really clarified and shared with us a perspective of how different it is. If someone with that access and that level of insights and knowledge and expertise can't navigate it, who can? Right? So, and we have to acknowledge the wonderful efforts of our vendor friends out there. This is tough stuff, right?
Certainly.
There's a reason we have conferences here at class about interoperability and all of these challenging issues in healthcare, but we think more can happen. There's definitely more that can be done.
Right.
You know, I think it would be great to share one of our favorite quotes we've heard of why the patient voice matters. Do you want to talk about that one?
Yeah, this is from Adrienne Boise, who's over patient experience at the Cleveland Clinic. And this is one of our favorite quotes. She said a few years ago that it's an oxymoron to call it patient engagement and not involve the patient. And that really is the core of why we're doing this podcast, is to really bring the patient front and center and not kid ourselves that we're doing patient engagement work and not involving the patient. Well, Adam, that's a great example of some of the short and quick insights that we'd like to share over the course of this podcast. I know you like to end these episodes with a quote that you've heard or read. So why don't you share one with us today?
Okay, I've got a good one. This is from Dr. Bernard Lown. He was a cardiologist and inventor and credited with helping create the first direct current defibrillator out there. He said, "In my view, the lost art of listening and ignoring the patient as a human being is a quintessential failure of our healthcare." Paints a good picture of what we want to focus on, so glad I could share that. Dan, this is awesome and fun for me. Always good to be with you. Thanks for your work, and we've got a lot to talk about.
Yeah. Stay with us. We're excited to share a lot of things over the next several episodes. We look forward to interviewing several guests and hopefully providing some good content for our listeners.
Thanks a lot.
Thank you.